Everybody, welcome. I have to say how excited we are to be here at the Arc in Greeley.
Yeah.
Yes.
And we all know that people with intellectual and developmental disabilities are really an important part of Colorado, and they have needs that we need to meet as a society. And too often, there's been too many folks with intellectual and developmental disabilities that have gotten sort of stuck between the behavioral health and the IDD system, and they might not get the care they need. Because just like every other Coloradan, people with intellectual and developmental disabilities can get depressed, they can get anxiety, they can have some of the same behavioral health needs as anybody else. And we don't want anybody to ever get lost in that process. This bill helps fix that by making sure that the HCPUF, a state agency, trains and improves the response and the crisis response to people in need to better meet them where they are. Now that we've all experienced the pandemic, we've seen that it's often easier to train people through teleconferencing, and so we can do that statewide, and we can save money and make it easier for rural people to get trained by doing that and compensate the providers for their participation. This bill, HB 21-1166, I want to thank Representative Young, who's with us, Representative Will, and Senator Janal from just west of here in Larimer County. I want to, in addition to thanking the sponsors, really turn over the mic to our administration's leader in improving our state's mental and behavioral health system for everybody, Lieutenant Governor Diane Primavera.
Well, thank you, Governor, and I also want to commend the incredible work of the bill sponsors, Representative Young and Will and Senator Janal, as well as all of the advocates, the providers and supporters here today who've worked so hard to pass this really important piece of legislation. And as the Governor said, this bill will further our mission to create a Colorado for all by streamlining our behavioral health system, ensuring that it's connected and can serve Coloradoans with intellectual and developmental disabilities and co-occurring behavioral health needs, especially when they are in crisis. So I started my career at 16 years old. I won't tell you how many years ago that was, supporting individuals with intellectual and developmental disabilities. And my first job out of grad school was right here in Weld County as a case manager at the Community Center Board. And since that time, I've spent my career continuing to advocate for Coloradoans with disabilities, and including recently hiring a disability policy advisor in my office, and I think that's the first time in Colorado history. So throughout my career, I've seen how important it is that our most vulnerable communities have access to the services that they need and when they need them. This bill empowers providers to coordinate across siloed systems, helping them more effectively respond when individuals with intellectual and developmental disabilities are in dire need of behavioral health care. Behavioral health reform will require numerous changes to the existing systems, and House Bill 21-1166 helps address one of those needs. So together we can create a behavioral health system that does not leave anyone behind. So I really want to thank the Governor for signing this bill today. It couldn't be more important. And I'd like to turn the microphone over now to one of our really hardworking sponsors, Representative Young.
Thank you, Governor and Lieutenant Governor. I am so honored to have you here for this bill signing. As you know, the Governor and Lieutenant Governor are extremely committed to improving behavioral health care in this state, and that is why it is so important to me that they are here for this bill signing. I want to thank them. I want to thank my co-sponsors. I also want to thank the ARC of Colorado, who has been on this journey with me for over 2 years to develop this bill. It really reflects the work of the task force, but we were a little cutting edge. We had a bill developed before the pandemic that included teleconferencing for training, and that's essential to this bill. As has been said, this bill addresses an ongoing lack of access to care for individuals who are identified as intellectually disabled who also have co-occurring behavioral health needs. by training behavioral health providers to meet the unique behavioral health needs of this population, we reduce the likelihood of their involvement in the emergency room, in out-of-home placements, in psychiatric care, and most important, the judicial system, including jail and prisons. We know that individuals with cognitive disabilities are 4 times more likely than the general population to be jail inmates, and jail inmates 6 times more likely. This kind of training for providers is crucially needed. It's designed to be delivered by, as I said, by teleconferencing, and this bill provides essential training to continue to increase mental health parity for individuals with cognitive disabilities. So glad you are all here today from our community and Greeley community for this signing.
Should we make it official then? Okay,
Yes.
here we go. It's officially the law of Colorado. Congratulations,
Yeah.
everybody.